Good afternoon, I'm Chao Suen. Thanks for joining us on ST Live. There are 2 more cases of monkeypox in Singapore, bringing the total number of infections here to 8. 4 are local and the remaining 4 imported. They are not linked to one another. According to the Health Ministry, one of the 2 new cases is a 46-year-old man from Estonia who came to Singapore from London on July 21st. 3 days later, he tested positive for monkeypox after developing rashes in his groin area, as well as fever and swollen lymph nodes. The other new case, a 26-year-old Singaporean man, also developed rashes in the groin area and other parts of his body. He also tested positive on the 24th. MOH says both were taken to the National Centre for Infectious Diseases and are in stable condition. In a social media post this morning, Health Minister Ong Ye Kung says that given the self-limiting nature of monkeypox in Singapore, the Health Ministry doesn't recommend mass vaccinating the whole population against it, because the benefits don't outweigh the risk. Now, monkeypox is a global public health emergency, putting it in the same league as COVID-19. Over 16,000 cases have been detected in more than 75 countries, up from about 3,000 cases less than a month ago. According to the World Health Organization, the threat is high in Europe, with the UK and Germany each reporting more than 2,000 cases. In the Americas, cases stand at more than 2,500 in the US and over 600 each in Canada and Brazil. And in Asia Pacific, 41 in Australia and 8 in Singapore. And here with more is Professor Dale Fisher. He sits on the WHO's Global Outbreak Alert and Response Network. Thanks so much for joining us, Professor Fisher. So if I could just go back to COVID-19 first. Shortly after WHO declared it to be a global health emergency, COVID-19 was classified as a pandemic. So now that WHO has declared monkeypox to be a global health emergency, what does it mean for Singapore and the world?
So actually, the WHO's terminology is public health emergency of international concern, or as you said, a global health emergency. That's the main sort of statement that the WHO can make. So pandemic is very much in the language of other people. And if you remember at the time, WHO was actually reluctant to call it pandemic because, you know, really a pandemic means a disease that's spreading across the world, and that's kind of fairly obvious, but it's the implications of that spread which can make it an emergency, and in those regards you have to bear in mind how serious it is, how severe it is, how unusual it is, can it affect international trade, and really is there a need for a coordinated international response. So with COVID, obviously it was serious, unusual, impacted international trade and movement, but that's been part of the debate is that most of those boxes aren't ticked through monkeypox. It's obviously unusual and novel and going to countries where it's never been before, but most people don't regard it as likely to impact international trade. And I think there's been 5 deaths out of the 16,000, so it's not a overly lethal condition. So this is why it's been controversial as to whether to call it an emergency or not.
Speaking about that, you know, so there was a sort of disagreement within the expert panel as to whether or not to even declare it, an emergency, a global health emergency. You know, what's your take on that disagreement in the first place?
Well, you have to consider, what does declaring it a public health emergency actually trigger? The short answer is nothing. It doesn't release a whole lot of money. It doesn't necessarily create a whole lot of activity. It's really a call to action, if you like. It's a shake-up of many countries that might be sort of undercalling it. And of course, the more you call it, the more you don't call it a public health emergency, that can be interpreted by some countries as saying, okay, it's not something we need to worry about. So I think Dr. Tedros was quite right to escalate it, But the truth is we've already got therapeutics and vaccines, and maybe this will trigger a more coordinated sort of production line and distribution of these types of things. And within countries, maybe it will trigger more contact tracing, more isolation, more testing, more availability of labs, better communications with the at-risk groups. This is really what we want to see, and these would be the reasons for doing it, for calling it a public health emergency. I don't think it'll make any difference in Singapore. I think Singapore's way ahead of the game in all these areas. So it's more of a global call to action.
So, Professor Fisher, who do you think, in your opinion, is the most vulnerable, and what are the steps that we can take to protect them and keep monkeypox under control in Singapore, before it gets out of hand?
Well, I think it's well known now that the vast majority of cases are occurring in men who have sex with men, and it's transmitted by close contact. We still don't believe it's specifically sexual contact, but obviously sexual contact is a very close contact, and the more contacts you have, then the greater the rate of spread. So this really needs to be a targeted effort at those particular communities, perhaps urging them to have less close contact with less people and really minimize the spread. It's about communications to those groups and helping them understand how to protect themselves and stop the spread. It's about having easily available testing. But testing, of course, isn't the answer like it was a much bigger part of the answer in COVID, because a lot of the times, if it's early disease or mild disease, it can be very hard to find a vesicle and then to swab it and get a positive result. So it's a little bit more complicated.
Do you think that there are any particular challenges, especially considering the sort of sensitive nature of communicating, these issues, particularly in the Singapore context?
Yeah. Once you start, you remember the outbreak in the karaoke bars. Contact tracing becomes very complicated when people have incentive to perhaps not be completely honest with who was where, when, with whom. So contact tracing and therefore messaging to those contacts, perhaps vaccinating those contacts, testing those contacts. This all becomes very sensitive and has to be managed very sensitively.
Thank you so much, Professor. This has been Professor Dale Fisher from WHO's Global Outbreak Alert and Response Network. StraitsTimes.com has more expert reactions on WHO declaring monkeypox a global health emergency. Don't forget to hit subscribe to stay informed and activate the bell icon on YouTube to catch live news updates. I'm Chao Suan. Thank you for watching.